гостях професор Шінохара. Він професор-невролог з Токіо, Японія, і голова робочої групи зі створення японських рекомендацій з менеджменту інсульту. Dear Professor Shinohara,
Yes.
I'm managing editor of the leading Ukrainian journal for neurologists, International Neurological Journal. Here is the last issue of our journal, and you can see it after our interview. And now let's start. First of all, I would like to ask you about visiting Ukraine. Are you visiting Ukraine for the first time?
Yes,
Yes.
it is first time.
It's your first time here. And tell me, please, how are your impressions of our country? How are your impressions of our city, of our doctors, neurologists? What can you say about it?
Well, you know, I got the invitations twice from this country. And one is last year and the other this year. Well, last year, unfortunately, I could not come because of my tight schedule. But well, this year I could come here, and I'm quite happy about that. I stayed in this country only 2 days, so I don't know exactly the situation in this country. But well, my impression is quite good, because that well, despite terrible traffic jams and bumpy road, but anyway, the city itself were quite quiet and beautiful and clean, very clean. Well, people seems to be very gentle and quite active. So I think that well, this country seems to be very nice country. Although I know that you have some problems with neighboring countries, but my impression is very good. Yeah.
Yes, thank you very much. It's nice to hear such kind words. Thank you. And now let's start to speak about your professional activity as a neurologist, as a scientist. So I know that you have been a president of such a Japanese organization like Japanese Stroke Society and Asia Pacific Stroke Organization.
That's right.
And now please tell us some words about the activity of these organizations and how these organizations try to fight against stroke.
Yeah. Well, regarding the Japan Stroke Society, we established it in 1975. That is about 45 years ago. Well, members include neurologists, neurosurgeons, and the neuroradiologists, and some basic doctors who had an interest in stroke. But we have now more than 8,000 members, only doctors. Yeah. And then we have annual meetings once per 1 year. And well, we can have a good discussion between the neurologist and neurosurgeon, and also we can exchange idea about the stroke research and so on. And also we have journals regarding stroke 6 times a year in Japanese, and then another journal in English 6 times a year. And well, regarding the APSO, that is an abbreviation of the Asian Pacific Stroke Organization. Its history is rather new, and before 2009, we have 2 kind of stroke association in Asia. One is Asian Stroke Forum, and then the other was called APACAS, that is Asian Pacific Conference Against Stroke. But you know, in Asia, we thought that we don't need 2 societies. So, well, about 2007 or some, well, at that time, anyway, we talked with a long we talked with the Abacus group for a long time. And then finally in 2009, we can succeeded to merge them. Well, now that in this Abacus APSO, well, we include Japan, Australasia, that is Australia plus New Zealand, and well, China, Korea, Taiwan, Hong Kong, Thailand, Indonesia, India, Malaysia, Singapore, Pakistan, and so on.
So widespread geography of representatives.
We have an annual meetings every once for every 2 years. I was the first and the founding president of that APSO, but now I'm retired from the society. Yeah.
I know some statistical data, and I know that if to speak about this rate, about stroke death rate, Japan takes 157th place in the world. But if to speak about our country, about Ukraine, Ukraine takes 45th place. And tell me please, how do you think, what are the key factors of Japanese success in such good fight against stroke?
It's a very tough question. Well, you can see this slide. Well, for a long time, as you see, the red one is mortality from stroke. So after the Second World War, well, the stroke was the #1 cause of death in Japan for a long time. However,
till 170.
Yeah, but well, from the 1965 to 1970, the death rate tremendously decreased like that. And now, that stroke is #3 or #4 cause of death in Japan after all malignancies and all cardiac diseases, including cardiac failure. This reduction mainly due to, as I show you like here, availability of universal health insurance for all Japanese people. 100% Japanese people had some kind of health insurance. That is one factor. And also, well, at that time, we developed a tremendous, extremely effective antihypertensives. And also, we tried to have an effort to reduce salt intake for the Japanese people. Because those reasons, well, we can let them decrease the mortality from stroke. But it's has a long history. Yes, yeah.
But you told that the first reason is the covering of Japanese people with insurance.
Yes.
Okay.
Yes. Of course, 100% means 100% of the people had the insurance. But that doesn't mean that all people can get the medication freely. Well, some people must have 30% of the 30% of the money which he used for their medication. But well, some people can get 100%. Well, it's depend on their income or depend on where you are working and so on. Yeah.
Okay. I also know that you have been a chairman of the working group for the development of Japanese guidelines for the management of stroke.
Yes.
Tell me please about these guidelines and how often are they updated, and when was the last update of such guidelines?
Well, we already had 3 guidelines since 2004. And well, we are now ready for the 4th edition in Japan. Well, pretty soon it will be published. Yeah, that means that we have guidelines every 4 to 5 years. And also we have an English language version in 2011, which was published in the Journal of Stroke and Cerebrovascular Disease in 2011, I guess, yes.
So, but the last update was this year,
Yeah.
2019. Okay. And I also have read that you are the co-author of one of the international articles where there was compared the American and Japanese stroke management guidelines. And tell me please, what are the key differences between Japanese and United States protocols of management of stroke?
Oh yeah, okay, I'll show you by this slide. Well, actually, regarding the similarities and the difference between our guidelines and the US or European guidelines, well, we discussed already with Professor Henrich, a German doctor, and then we discussed and we already published this matter a few years ago. But well, our conclusion was, well, fundamentally, there is no big difference between two guidelines. However, we have a few differences between Japanese and Western guidelines, and they include, as shown in this slide, a smaller dosage of TPA and use of neuroprotectives, edaravone, in acute phase of stroke, and use of antiplatelet, cilostazol, for the stroke prevention, and lower dosage of anticoagulant for elderly patients, and so on.
So you want to say that in Japanese population, they use the smaller doses of TPA, if to compare with Western population.
Yeah, that's right.
Okay. And now let's continue about treatment of ischemic stroke. Of course, it is well known that the first step of treatment of ischemic stroke is thrombolysis. If to speak about thrombolysis in Ukraine, it's a pity to say such things, but less than 1% of Ukrainian people with acute stroke receives thrombolysis. And tell me please, how common is thrombolysis in Japan?
Yeah, well, it was not so high even in Japan. First we started the TPA treatment. It was only 3 to 4% at that time. But nowadays, but still only 9 to 10% of the acute ischemic stroke patients are receiving TPA. That is because that in some case we thought that it is not necessary to use TPA, or they came to the hospital a bit later, and so on. Yeah, but we are trying to increase the percentage of the people who can get the TPA. We are trying to do that.
It's very interesting that in Ukraine is the same reason why so less quantity of people gets thrombolysis because of late coming to visit to hospital. Yes. And now let's continue about treatment of stroke. And you told yesterday during your lecture, and I've read also that in 2009 edaravone was included in Japanese guidelines of management of stroke, as the drug with proven efficacy, and edaravone is used in Japan nowadays too. And tell me please, why such decision was taken? So why the working group of guidelines decided to include the Darabon into these guidelines?
Well, of course, that Darabon was not used for every patient in Japan. Not 100%. But well, if patient have only a very mild stroke or on the contrary, too severe, we cannot do anything at all. In that case, we don't want to use the Darabon. But the other case, usually we use Darabon only, or Darabon plus TPA, or TPA plus endovascular surgery plus Darabon, something like that. And now, almost 50 to 60%, 50 to 60% of the patient had a Darabon in Japan for 1 year. Yeah.
To continue your thoughts, I would like to ask another question. Tell me please about the patients who use the Darabon and TPA. When you administer the Darabon to such patients, before the administration of RTPA, in the same time with TPA, or after using the TPA?
Well, I don't think that it's not so big difference if you use the Darabon before the TPA or after TPA. Our studies show that the efficacy is almost same, even if you use before TPA or after TPA. But you know, Darabon can act for the free radical. So the free radicals will product in the acute stage, very extremely acute stage, and also after the recanalization of the blood cells. So you may use in both in any time, you know, before the TPA, after TPA. But regarding TPA, well, regarding TPA, you can use only once. But that one you better to continue to use for well, at least 7 days to 14 days.
From 7 to 14 days is the continuing of using Darabon in stroke patients in Japan, right?
Yes, right.
Okay.
Yes.
And now let us to continue the topic about pharmacokinetic and pharmacodynamic of Darabon. You told it goal is free radicals. So tell me please, if you studied this question maybe, are some differences in pharmacokinetic and pharmacodynamic of Darabon in Japanese population and, for example, in European population?
Well, I don't think that well, there is a big difference between the Japanese and Caucasian people regarding the pharmacokinetics of the Darabon. There are several data papers showing that there is no difference at all. So I think that there is no problem at all.
No problem, no differences. Okay, and tell little about your own experience about using of Darabon in stroke patients, and maybe you can say about some adverse effects or absence of adverse effects of such using.
Well, only the side effect of Darabon is you cannot use the severe kidney dysfunction patient. Well, there is small report regarding side effect of Darabon, but from my experience, well, except for this kidney dysfunction, you may use any patient.
And we have talked about covering of insurance of Japanese patients, and so let's continue this topic. And if to speak about the Darabon and covering with insurance.
Yes.
Tell me please, must Japanese patients pay for using Darabon, or insurance covers this
health insurance
outcomes?
will cover Darabon completely.
It's very good, really.
Yes.
Yes, and also tell me please, have other countries from Asia Pacific Stroke organizations included Edaravone in their stroke guidelines?
Oh yeah. Well,
and what countries also?
Yeah, it's very tough questions because that, these guidelines are written or recommendations are written in their own language. So it'd be very difficult to find out, you know, where is okay and where is not. But anyway, as far as I know, that it is included at least in Taiwan guideline and the Chinese guideline and Korean guideline, and so forth. Yeah.
Interesting. Okay. I think that I finished my questions about Edaravone, about your scientific activity, and now I would like to ask you to say some words to our readers, to Ukrainian physicians, neurologists, because our readers are practical, Ukrainian practical physicians.
Well, it's again a rather difficult question, but well, first of all, I think that we should make more collaborations, and we should exchange more knowledge more precisely and very often. Often we should have a chance to exchange our knowledge. Well, if I can do anything for your country regarding the stroke, well, I will do my best. And if I may say, well, actually for this 100% insurance and so on, our government did a big effort. And not only the medical government, but also our medical societies, not the stroke society, whole medical society did good jobs. So if I may say, your government and all medical societies should have more interest in people's health in your country. Well, I'm not a communist and I'm not a right wings, but anyway, the people's health is most important for the nation. So if you don't have interest in it, the nation will be gradually declining. So doctors and medicine-related people in your country should raise a cry for the more improvement of national, national improvement of people's health. Well, for example, in Japan, as I told you, that almost 100% of people had a health insurance, and also almost 70% of the people had people aged more than 40 years have received comprehensive health checkup system once a year. It's a duty. Yes. So, well, then of course it is free completely. So, well, this is because of the leadership of the government and also medical societies. Well, people are thinking that it is their privilege, right, to receive this kind of health checkup in Japan. Well, so maybe it is not in this country, I guess. So otherwise, well, it is impossible to improve the situation in your country, if I may say. Well, however, I know it is a kind of overstatement. So you may dilute these sentences. But anyway, finally, I would like to say cordially that thank you very much for your invitation to this beautiful and quiet city and kindest hospitalities. Thank you very much.
Thank you very much, you too. Thank you for visiting our country, and I hope that it's not your last visit to our country, and I invite you to come to us more and more. Thank you very much for such interesting talk.
Thank you very much.